A new instrument for health literacy evaluation among people living with diabetes. This research was done by a research group. It is a teamwork. There are 5 steps. Diabetes is a world public health problem. It is increasing fast. In considering the dynamics of the conceptual framework model for action of the social determinants of health, it was found that health literacy is considered an intermediary health social determinant. This has an impact on the equity and well-being of people living with diabetes, a growing Brazilian public health problem. There is a close correlation among diabetes, quality of life, and health literacy. It is believed that the word was first applied by Simmons in 1974, introduced in the dictionary in the USA and England, considered by the USA and UNESCO as well. Currently, it is considered that the concepts of formal education and literacy are different. A search has started to conceptualize, measure, and improve literacy levels among people. Literacy in Brazil. The term was cited in Mary Cato's book. Lida Verdiani launched the word literacy in the world of education. Kathy Goulart published the first manuscript resulting from the evaluation of HL in Brazil. Professor Nutbean presents a concept. This concept was adopted by who? It has been difficult to come up with a single concept reflecting the complexity of the theme. Published a systematic review that aimed to integrate concepts and models of HL. The health literacy integrated model is dynamic. Social and environmental determinants, situational and personal, they have impact. Health literacy, for better health outcomes. However, the literature lacks instruments to estimate HL, levels of access, understanding, evaluation, and application for diabetes information. To present the long version of a new instrument for health literacy evaluations among people living with diabetes. Methods. It is cut from a cross-sectional exploratory epidemiological study. It is a methodological study conducted in a Brazilian municipality. Ethical aspects were considered. Study population were considered. Inclusion criteria and exclusion criteria. Sample planning. It was estimated and identified the need to evaluate 355 individuals. Investigated variables. Investigated variables were allocated in 7 groups. Investigated variables considering Sorensen's model were allocated in 7 groups: socioeconomic, demographic conditions, contextual variables, individual variables, and diabetes-related HL. Access to and use of services. Health behavior, adherence to drug treatment. Food frequency questionnaire. Health behaviors, adherence to drug treatment. Health outcomes. Empowerment. Satisfaction with social support. Database collection and construction strategy. Database collection and construction strategy has 8 steps. Statistical analysis. Descriptive analysis. Results and discussion. Answer rate 90.70%. Most were woman, married, had on average, years of schooling 9, age 62, per capita month income $239. A new instrument. 155 questions, 10 general questions, other 145 questions. Table 1, health literacy regarding diabetes among people living with diabetes registered in the primary health care, 2016 and 2018. Most, yes, had access to any information about diabetes. In the last month, once a month. Most understood everything, was able to evaluate it easily if the information was indeed true, was able to rank it easily how important it was. Most was able to evaluate it easily if it was of good quality, was able to evaluate it easily, the pros and cons of different treatments for diabetes. Most sometimes apply the information about diabetes, always apply the information about diabetes correctly. Table 2, health literacy regarding diabetes among people living with diabetes registered in the primary healthcare, means of communication, interpersonal contact with professionals or non-professionals. Most got information from a physician. The last time which they had access in the last month was from a community health agent. Most understood everything about diabetes from a physician and a community health agent. Most were able to evaluate the information from a physician and a community health agent easily. Most always apply the information from a dentist, surgeon, oral health team. Table 3, topics about diabetes literacy addressed in communications. Most received the information about food. Most, the last time which they had access in the last month was about physical activity. Most understood everything about alcohol consumption. Most was able to evaluate the information about tobacco and snuff easily. Most always apply the information about the use of medications. Table 4, means of communication, reading. Most read the information about diabetes from a magazine. Most, the last time which they read in the last month, it was from internet. Most understood everything and was able to evaluate the read information from a magazine. Most always apply the read information from medical prescriptions. Table 5, means of communication, sight, hearing. Most watched, heard information from a television. Most, the last time which they watched, heard in the last month was from the internet. Most understood everything and was able to evaluate the watched, heard information from television. Most always apply the watched, heard information from lecture, conference. 9th Global Conference on Health Promotion. The 3 pillars of health promotion were presented: good governance, healthy cities, health literacy. To control diabetes, adherence to medication, physical activity support, encouraging healthy eating, among other factors, considering the health literacy concepts and proposals. Health promotion among people living with diabetes. What? Health literacy. Why? Studies have shown that low HL is a barrier to equity and well-being. How? Improving communication. Where? All over the world. When? Throughout life. Who? Everybody. Different levels of HL regarding diabetes. Access, 1.6% to 91.9%. Comprehension or understanding, 5.4% to 69.5%. Evaluation appraisal, 10.5% to 71.9%. Application, 4.5% to 57.5%. These results point to the necessity to search for new answers. Association or correlation studies are necessary to elucidate questions regarding HL. The theoretical model proposed by Sorensen and collaborators is a heuristic model and serves for the discovery or investigation of facts. It is a conceptual basis for the development of HL measure instrument. Measurement of health outcomes are essential in scientific research and in clinical practice. Health status measurement instruments should therefore be reliable and valid. It is necessary to appraise the quality of instruments for evaluation of health-related events. Lidwine B. Mokink et al. Published the Cosman Checklist for assessing the methodological quality of studies on measurement properties of health status measurement instruments, an international Delphi study. In this research, there are good results in the internal consistency and in the test-retest. Validity and responsiveness were not the objective of this research. Limitations: number of participants, uncertainties regarding the quality of instrument for HL evaluation, limitations in the discussion because there were not other surveys to challenge the results. We didn't have questions that measured teach back or show me. On the other hand, the subject seems to be unprecedented. This study may be considered a preliminary phase of comparative studies. Conclusion: psychometric assessments made associated with the proven content validity and reliability already shown, suggests that HDL longer, among other versions coming from this instrument, could be used in primary healthcare in future studies to estimate literacy levels, with a view to the elaboration of health policies consistent with reality. Thanks.